For non-blondes, wait, what's up? Right here on TRAXXfm. Today we're talking about breaking the HIV stigma and treatment and prevention, right? So this is a major cause of concern, right? A lot of stigma involved behind it as well. And today to talk to us about it is Nurul Akmar Anwar, who's a pharmacist. She works at the Klinik Kesihatan Seksyen 7. Shah. Hello and welcome, Nurul Akmar. How are you today?
Hello, good morning. I'm honored to be here.
All right. So we're going to talk about HIV punya stigma, right? So the treatment and prevention. Now, we start off with, what is HIV, right? And is there actually a cure for this disease? We start with the big question first.
Let's go into the disease first. So we go with the definition. So according to World Health Organization, WHO, human immunodeficiency virus, or after this I'll just call HIV, is a virus that attacks the body's defense or immunity system and weakens an individual's ability to fight off infection optimally. Okay, so with HIV, it can go undetected in our body for quite a long period of time before it's being detected, showing its
symptoms and all that.
lah. So if left untreated, it can lead to AIDS. AIDS ni apa pula? AIDS stand for acquired immunodeficiency syndrome, and it is the last stage of HIV infection. So if you're already in this stage, you can easily get sick, and a lot of infection can easily gets to you lah. Okay, so how does it transmitted, this HIV? So according to an article in the official portal in the Ministry of Health Malaysia, MOH, HIV can be transmitted through several bodily fluids lah, such as our blood, semen, vaginal fluid, and also breast milk. Okay, so with this, it can spread through sexual intercourse, sharing infected needle, and transfusion of blood and organs contaminated with the HIV virus, or from infected mother to her unborn child, either before, during childbirth, or breastfeeding.
Yes. So that is, I think, concerning HIV, right? That is where the stigma rises from. It seems to be something that it's only, back in the day, there used to be so much, shows, even on RTM, showing how HIV transmits and why, like sharing of needles, unprotected sex, and all of that. So those are scary, and it has caused a bit of a stigma, right? People think only sex with random people can cause all of it, but the part where mother can actually transfer to the child, that's not very well known. So let's talk about statistics as of right now. Could you please share what the latest statistics for HIV cases in Malaysia this current time?
Okay, sure. So I'm going to compare from 2002 compared to the latest one, is from 2023. So back in 2002, the infection rate is 28.5% per 100,000 people. And right off now is 9.7% only per 100,000 people.
It has gone down.
It's a significant reduction already.
Wow. Okay, that is good news.
Yes, it is.
All right.
So do you want me to go into the
Yeah, for sure.
Okay.
You've got the details right there. Of course I want you to talk about it.
It's good to know lah.
Yeah. Because even I didn't know. I always thought, diseases like this will always be on the rise, but you're saying has gone down, which is good, but that 9% is still scary. So what you got for us?
Okay, so it's one to do with our awareness already nowadays, so people is more aware. Although the stigma is still there, but never mind, we will address that one later lah.
Yeah. Okay, sure.
And also about the transmission just now kan. So for HIV, it cannot spread through fluids like tear, sweat, and saliva. So it is okay if you want to shake hand, hug, or even share food with people living with HIV. That is not a problem.
Yes.
Okay. So, back to the statistic, right? Sorry if I'm jumping.
Don't worry.
Okay, so in 2023, a total of 4,502 cases of AIDS and HIV were reported. So if we break down further, it's 1,282 AIDS cases and 2,841 HIV cases. And men is the majority of these cases been reported compared to the female counterparts. Okay, and then we talk about the general population. Right now in Malaysia, there's around 85,000 people living with HIV.
Out of 30 something million.
Yes, correct. Okay, and compared is a slight increase from 2018, which is 84,000.
So about 1,000 more lah. All right, all right.
Here is where the statistic get a bit more concerning because in 2023 it found that 244 university students aged 18 to 25 are affected. So that is quite a young age lah. So marking a 31% increase from 2021. So this one accounted about 7% of the new HIV cases.
Yeah, we actually read about that. I think that caused a bit of a concern and a lot of testing and all of that. But talking about testing, right? Because there is a perception that HIV testing is actually difficult to conduct at clinics or hospital. It can only be done if you're symptomatic. As you said, it stays dormant in your body for very long, and afterwards it shows up with symptoms. What is the perception, right? How can we correct this, and actually what service options are now available?
HIV actually is still a bit of a taboo subject, right? Among Malaysians still lah. But actually, you can get tested it for free at health clinic and hospital. But nowadays, there are also services where it's not only limited in hospital or clinical setting where you need to be tested on lab, but you can also buy your own self-test kit. Yes.
Oh, wow.
Yeah.
That's surprising. I didn't know such a thing existed.
Yes. It's been widely
Available.
Not widely available, but it's been
Produced.
known lah.
Okay.
So, if you interested, you can either get it from online. We have a government punya government
E-commerce punya website.
Test Now.
Test Now.
www.testnow.com.my. Or if you prefer, you can also get it from selected community pharmacy.
Okay. That's cool, because like sometimes some people just to avoid the taboo, just to avoid the stigma, they might not even get tested. They would rather just in their head believe that I'm okay. But this is like the person won't know, but you will know. So it's much better, right? Because you don't want other people to know yet, or something like that, just to avoid the taboo.
Yeah, because some people, like I say just now kan, macam HIV ni, it can go undetected in your body for the longest time. So some people, they just bear with, even if they have any kind of symptom, maybe just like prolonged cough, a bit of skin infection, and they try to bear with it, and it doesn't cross their mind to get themselves tested. Maybe because of the stigma or anything else lah.
Yeah.
Some
people just want to live with there's a saying, ignorance is bliss.
Yes,
which means if you don't know, then you're not scared. Because for a lot of people, they don't know that HIV can be managed. So the moment they hear HIV, oh no, I'm gonna die. Oh no.
That's the end game kan.
Yeah.
Now the the perception has slowly shifted lah. So with the self-test kit kan, so you don't need to tell anyone. So the beauty of it is that it's private and confidential.
Private and confidential. Yeah, that's the word I was looking for.
So you can be done at your own comfort at home, and the result can be obtained quickly lah.
Yeah.
Within just a few minutes.
Oh, it's like a COVID test kit.
Yes, correct. Betul.
Oh, not bad at all. All right, so let's talk about the spread of HIV, right? One way to prevent the spread of HIV is, of course, by using condoms. This has been already back in the day itself. They already told us this. Now, besides using condoms, are there other methods that can actually be done for HIV prevention?
Okay, so for the longest time, the condom use is the primary method lah for
to prevent the spread. Yeah.
Relation kan is the most effective, up to 99%. But with the advancement in medical medical field ni, now there are other methods where we can use pre-exposure prophylaxis treatment. In short, is PrEP lah. So this one you can also provide 99% protection when taken consistently and correctly by those who at risk as HIV infection. So even but this one is quite new actually, PrEP.
Yeah, I've never heard of this before. So could you elaborate further on what is PrEP?
Even in our Ministry of Health itself, is still a quite new treatment option for people living with people at risk of
HIV.
Yes, correct. So in 2023, MOH has implemented the PrEP growth 2023 initiative. And currently we have around 35 healthcare clinic that Klinik Kesihatan lah, which offer this PrEP services.
All right. So once we're going to take a short break, and once we come back, we're going to be talking about PrEP, more about PrEP, and also methods of taking PrEP, and does it protect against other STIs, or otherwise known as sexually transmitted diseases. Right, so we're going to be back in just a few moments. By the way, if you're on TikTok, you can ask us questions, and if it's pertinent to the topic, we'll be more than happy to discuss it. But ask early, so I can discuss with the pharmacist first. Our pharmacist today is Nurul, Akmar, Anwar. She's from Klinik Kesihatan Seksyen 7 Shah Alam. We're going to be back after this. Don't go anywhere. back, and we are currently talking about breaking the HIV stigma with treatment and prevention. We have Nurul, Akmar, Anwar, who's from Klinik Kesihatan, Seksyen Shah. Alhamdulillah, we have a question all the way from Cebu. The question is, I would like to ask, this is from by Bronze Fancy. If someone who is living with HIV is already on PrEP and no detected SDI, can they stop taking the medicine? That is the question. What do you think,
Okay.
Puan?
There's a bit of question with that question sebenarnya. Sebenarnya if you're already having HIV in your body, you're not taking PrEP anymore. PrEP is only for prevention
From you getting it.
Getting HIV.
If you're leading a lifestyle that might be
Yes, high risk.
high risk lifestyle, yes.
Lifestyle, what we call it. So if people with already having HIV, what they are taking is antiretroviral therapy.
Oh.
HAT lah, what we call it, highly active antiretroviral therapy. So what's the difference between PrEP and HAT? For PrEP, you can stop at any time. If you're decided that you no longer want to be leading the high risk lifestyle, then you can stop it. But if you're on HAT, it's actually a lifelong
Commitment.
Commitment, yes, because one thing about HIV is our own body cannot get rid of the virus by itself.
Yeah.
And it can only be suppressed by using the HAT lah. HAT medication, which is a combination of 3 type of medication, antiretroviral drug, we call it. Okay, and it's need to be taken lifelong because we can only suppress the virus in our body and not to get rid of it completely.
Yeah.
So if people starting on HAT, they need to give their lifelong commitment taking this medication lah.
Yeah, because the first thing the HIV attacks is your immune system. So
Yes, correct.
so essentially your police in your body already kena wipe out. So you have to start bringing from outside lah.
Yes. And one thing, example, the CD4, it won't be like completely wiped out lah. But at first stage, they will start macam the HIV virus will dominate your body. And then you have the less capability untuk protect yourself from virus. And then if you fight off the virus with the HAT medication, then your body will repair itself lah. The CD4 will increase by itself.
Oh, okay.
Yeah,
okay.
that's the basic version.
All right. So I hope that answers our friend's question, who's all the way from Cebu, Bronze Fancies.
So if you already on HIV medication, the HAT then is lifelong. You cannot stop it.
Yes. If you're taking HAT, keep on going lifelong. All right. So that's the thing that is very, very scary because a lot of issues going on and all of that. So don't stop with that. Just continue because, like, from what I understand, if you do get AIDS down the road because of HIV, you don't die due to AIDS. You die due to something very unrelated. Most of the time, they say things like pneumonia.
Opportunistic infection.
Yes.
Call it, yes.
Simple diseases because your body can't just fight it off anymore.
Yes.
So that's the thing. If you're taking HAT, please do continue. But so now we know what's the difference between HAT and PrEP. So we're gonna start talking about taking PrEP itself. This is for people who are leading a high risk lifestyle. And is the method of taking PrEP complicated? Does it have serious side effects?
Okay, so let's talk about PrEP lah. So PrEP, pre-exposure prophylaxis, what it does is before the virus has a chance to enter your body and infect your immune system, it will act as a protection, like a gate. So it's keeping you. So any virus, it can come into your body, but it will repress it. So so you'll be free from HIV lah. So that's in the basic version of it lah. So is actually well tolerated by the general public, and PrEP is not only been done in Malaysia, but it's also been widely studied and used in many other countries. Even in the US, it's been implemented longer time than us lah. Okay, so it is recommended by the World Health Organization as an important step to address the spread of HIV. So even by WHO, they aim to stop AIDS by 2030. So that's not that long from now lah.
Yeah,
at least to
for 4+ years only left.
Years lah.
Yeah.
But we try to do our best also, doing our best to try and curb the HIV infection So if not curb the HIV, at least AIDS lah.
Yeah.
Because AIDS is the last
The end, the
devastating
end position,
one.
yes. Right. So just another update from Bronze Fancies. Now he says kita macam kira macam kita makan ubat 3 serangkai for ever life ubat PrEP, right? It's not PrEP, it's hard, but yes, you makan for the rest of your life.
Yes, correct.
Okay. All right. So talking about PrEP, you said it repels the HIV virus, right? Is it 100%?
Not exactly. Nothing is 100% lah. But,
Yeah, true.
with the correct use and correct use dengan timing, it can prevent up to 99% lah.
Up to 99%.
So this one benefit more for the homosexual punya memang 99%. Okay, so but if you combine it with condom use, then
Higher chances.
Yes.
All right, but there's nothing ever 100%, so that's all for listeners out there. Okay, now we move on. Does PrEP protect against other STIs like gonorrhea and chlamydia and things like that, or even pregnancy?
The short answer is no. So macam PrEP ni is only target to protect user from HIV infection. But not from sexually transmitted disease or pregnancy lah. So usually what I would advise is to combine it with use of condoms lah and other preventive method. So macam preventive method tu, I haven't touched about it just now kan. Other than using PrEP and condom, if person macam the high risk individual if they are using drugs ke apa kan, so maybe don't share needles, all that. That's quite important. And also important for them to undergo HIV screening from time to time lah. And one thing that I believe is in being faithful, not having too much sexual partner is also help to protect yourself lah. And I believe in transparency as well. So nowadays, because we are quite open lah kan. Okay, so it's good if you can discuss with your sexual partner, ask them for transparency if you have that if you're living with HIV or stuff like that lah.
Yeah, you would be very surprised how understanding people are nowadays.
Kan,
yes, true.
If the stigma is there, but those who understand, they are quite open with it.
Understood.
Yes.
Understood. All right. And talking about stigma, right? Stigma and discrimination from society make these individuals reluctant, unwilling to seek help, even when they have HIV. Where can they get assistance and support?
Okay. So from our side, we are already trained not to to
bias
judgment. But if you feel like you cannot reach out to the government side, we also have conjunction lah, macam collaboration with NGOs as well. Non-government bodies kan, like Pink Triangle Foundation, KLAS, Kuala Lumpur AIDS Support Services Society, and also other private clinics lah. You can reach out for them, and from there we can connect you lah. So from there, but if you want to start your HIV medication or even PrEP, don't worry, you can contact our
Klinik Kesihatan.
Klinik Kesihatan ke our officers. We've been trained to so that you not worry about stigma, discrimination, all that lah.
Yes, your privacy will always be there.
Yes, correct.
All right. And what advice can be given to individuals who want to obtain more information or support related to HIV and the use of PrEP in Malaysia?
Okay, so like just now I got mentioned this one website kan, yang testnow.com.my. It doesn't only provide you with the test kit and all that, but it also provide information, any kind of information you want for HIV, you can try and get from there lah. And also if there's people who are interested on taking PrEP, they can also contact our PrEP navigator.
Oh, there's a PrEP navigator. What does
PrEP
that mean?
navigator is the person who in charge untuk first macam people interested in PrEP kan. They can first contact these people lah. They are working with NGOs, so you can book appointment with them, and then they will channel you, direct you to us from government clinic lah, health clinic.
The easiest way to get it.
So you can just Google, maybe find PrEPnet, navigator, FPREP, and AV.
PrepNav.
PrepNav. There's a link tree. Then you can select from there the nearest KK closest to you lah.
Understood.
Macam tu.
Understood. All right. So, how about okay? Before we end this one, we talk about your opinions and all of that. What do you think should be done by, say, someone, say a family member? They come out. They say they have HIV. How should a family treat them or friends treat them? And how do we break the stigma that's building up?
Okay. So, last time, HIV used to be a very, what you call it, very depressing, because last time there's not much treatment. But nowadays, if you're taking people with HIV who's taking heart, they can live a relatively long life. No problem. So they can live as normally. There's no problem. You won't, if they're taking their heart medication regularly and their virus is undetectable, there's no problem if you want to live with them. Just need to be understanding. Try to understand the disease itself lah, the HIV infection. Get yourself educated more lah about the.
Absolutely. Get educated more. Stop jumping to conclusions, yeah?
Yes, correct.
All right. I think that's all the questions that we have for you today. But of course, we would love to have you again in the future. We'll talk more about other diseases as well. And before we end, is there anything else that you would like to add for our listeners?
Okay. I think not so much lah. But try to break the stigma lah. And if you think you're in the high risk group, maybe you can get yourself tested.
Yes, make sure that you get yourself tested. Make sure that if you do somehow come up positive, make sure you use all the medicines that is being suggested.
And love safely, love wisely.
Love safely, love wisely. That is true. Choose your partners well.
Yes, betul.
All right, with that, I think it's about time that we close for today. Thank you so much, Puan Nurul, for joining us today to talk about breaking the HIV stigma, treatment and prevention. All right, we will see you soon. And right now, it is back to the music on TRAXXfm. And I'll be back in the next hour. Don't go anywhere.